Oh, hey, how's it going today? My name's Ryan Bober. I'm an internal medicine doctor in New York City. I practice primary care, and I get to see tons of patients every single day with a whole variety of different conditions. And it's so exciting, but at the same time, there are so many questions that come up based often on misinformation that they find on the internet. And it is really hard to tell which sources of information are accurate, which ones can be helpful to you, and which ones are harmful. What kind of toenail fungus is this? How do I treat this tick bite? What is eczema? How do I treat my dizziness? What do I do for the best sunscreen? How do I treat Lyme? So a lot of these things come up, and I want to answer all these questions for you, and I intend to make videos on all these different topics over time. But today I want to start with something that has been very prevalent in the community: cough. So what is cough? How do we treat cough? How do I think about cough so that we can come up with the best way to move through your specific symptoms so that we can arrive hopefully at a diagnosis and more targeted therapy? Cough is almost always a response to some type of irritant or stimuli, whether it's internal or external. And identifying that stimuli is what's going to help us target your therapy. I first start thinking about cough by coming up with a branch point in time. So have you had your cough for less than 3 weeks or more than 3 weeks? If you have your cough for less than 3 weeks, then I think about things like allergies, new medications, and upper respiratory infections or colds. So we're all familiar with upper respiratory infections or common colds. Almost all of these are going to be caused by viral infections, although some can be bacterial infections, and I'll talk about some points to pay attention to later so that we keep you safe above everything else. With these colds, they usually last 10 to 14 days. Most of them will resolve on their own, whether we do anything or not, but they can be very uncomfortable. Most people will have some sneezing, coughing, runny nose, sore throat, mild fever, body aches, some chills, occasionally some diarrhea. But with these symptoms, we can manage the cough with some over-the-counter medications and some home remedies that are safe. If you have an upper respiratory infection or some of these symptoms that are consistent with that, it's also important to think about, are there any causes or any other symptoms that you're experiencing that would make us concerned that there's something else going on that we need to come into the office for? So things like this include, are you having fevers? Fevers are temperature greater than 100.4 Fahrenheit, 100.4, or 38 Celsius. Okay? So if you're not having fevers, are you having chest pain? Are you having trouble breathing? Are you losing weight? Do you feel dizzy or lightheaded with these symptoms? Do you smoke cigarettes? Do you have an underlying medical condition such as asthma or COPD that makes it more likely for you to have a worse outcome if you're having a respiratory infection? Are you pregnant? Are you immunocompromised in any specific way? Meaning, do you have an underlying immune condition that prevents you from responding as you normally would to an infection? Or are you on medications that lower your immune system and lower your ability to fight off infections? I would always err on the side of caution anyway if there's anything that seems abnormal for you. What therapies are available? Well, before I get to that, just a word from the sponsor. Just kidding, I don't have any sponsors because this is my first video. But you can listen to Kenny G in the background if you like him. We have two options that are over the counter that you can go to your local pharmacy and go check out, okay? Dextromethorphan and guaifenesin. So you might know dextromethorphan as Robitussin, Delsum, Buckley's. There's a whole host of names. It doesn't really matter. The generic version is fine. Just pick the cheapest one and go with it. But pay attention to the dose that you're taking. Typically you take 10 to 20 milligrams every 4 to 6 hours. Or you can take a higher dose less frequently, so 20 to 30 milligrams every 6 to 8 hours. But there are a couple things to be aware of about this medication. You shouldn't take dextromethorphan if you're on an MAO inhibitor. So these medications are not too common, which is fortunate, but if you're on one, you would know, and you shouldn't take this medication. Okay? There are another class of medications that can interact and increase the chance of a side effect called serotonin syndrome. So people that are on medications called SSRIs, and we would know these as escitalopram, citalopram, Celexa, Lexapro, all these generic and brand names for some of these medications. So pay attention to your medication list. If you're on one of those, you shouldn't have high doses of dextromethorphan because it can lead to serotonin syndrome. So I would talk to your doctor if you're concerned about what dose is safe to take for you, but at the same time, you could err on the side of taking a lower dose of this medication, 10 to 20 milligrams every 6 to 8 hours, rather than what I talked about before, to improve your chances of having a successful therapy without side effects. So the other medication, as I mentioned, is guaifenesin. Guaifenesin is an expectorant. So what this does is it increases the water along the trachea, or part of your airway, to help these small cells that exist along the airway to bring mucus up so that when you do cough, it brings up extra phlegm to hopefully help clear out some of this infectious process. Not everybody likes this, so you don't have to try it, but if you do take it, pay attention to the formula of the pill that you're picking up. They come in granules, which is a little packet. You put it on your tongue and you swallow it. There's no need to chew, and you should take it with a big glass of water. If you pick up the extended release formulation or the tablets, don't chew it, crush it, break it. Just swallow it whole with a glass of water so that it's more effective. Most people are familiar with the symptoms of allergies, whether it's runny nose, watery eyes, cough, some congestion in your nose, some bags underneath your eyes. These things are very common, and because it's so common, there's a variety of medications over the counter that can be useful to treat it. So I would start with picking a first or second generation antihistamine, such as Benadryl, cetirizine, loratadine, because these can target the body's symptomatic response to the allergens. Of course, if you want to get rid of the allergy, you have to identify the trigger for it, and there are a host of other medications that can improve this as well, and we'll talk about that in a separate video. But to start, considering if one of those antihistamines are helpful for you can be useful. Of note, with the Benadryl, if you take it, it can make you drowsy. So pay attention and review the label to make sure that you don't have any reasons you should not be taking the Benadryl. And most people like to take this at night because it can cause sedation or sleepiness. So finally, medications. There's lots of medications out there and lots of side effects associated with medications, but the one class of medications that has consistently been identified with a frequent dry cough is ACE inhibitors. So these are medications called lisinopril, captopril, benazepril that work on specific receptors to lower blood pressure, to affect positive impacts in the kidneys. They're used in heart disease, heart failure. They're very great medications, have a lot of indications to use them, but they can cause this nagging, itching, drying cough that can start within a few days and last up to a month and resolve when you stop the medication. Stop the medication only if your doctor says there's an alternative that's reasonable and safe, and they'll try to work with you to find a different medication that you can use. If your cough doesn't improve within a month of stopping the medication, then it likely wasn't the cause. Be right back. So if you don't have any of these conditions, and your cough has been going on for more than 3 weeks, and it starts to linger for up to 2 months, we start to call this a subacute or a chronic cough. So these coughs typically fall into a few categories and buckets with some specific treatments that we can think about. And we can go through a process to eliminate one by one to help improve your symptoms and hopefully give you a lot of relief. One is asthma. The next one is laryngeotracheal reflux, or GERD, or some variation of that. Upper airway cough syndrome, which is also called postnasal drip, or a post-viral cough. I'll start with the easy one. A post-viral cough is a cough that, as it sounds, is persistent or lasts for several weeks or occasionally months after you've had a viral infection. Often this is related to an asthma component that hasn't been identified in the past, or your body is behaving similarly as if you have asthma, where your airways are a little more reactive than normal and causing some of these symptoms of cough. And they can be treated with inhalers. So as a branch point, let's go ahead and look at asthma. So again, asthma is an inflammatory condition where your body and the muscles start to react inappropriately to certain stimuli in the environment. Whether this is dust, pollen, fragrances, cigarette smoke, and when you have an exposure to this, the muscles around the airway contract and cause poor airflow, meaning the air can't go out as easily as it can go in, and this causes the symptoms of wheezing, chest tightness, trouble breathing. It can sometimes happen with people just during exercise or just at rest, or anything in between. So when you have any symptoms of asthma, the treatment would be inhalers, but it would be important to get specific diagnosis first, and this could often include breathing tests called pulmonary function tests. But we'll talk about that more in a separate video. Okay, so if there's no evidence of asthma, then we think about upper airway cough syndrome. So this used to be called postnasal drip. It's a set of conditions, whether allergic or non-allergic, that all manifest with similar symptoms of some nasal congestion, some postnasal drip, which is the sensation of mucus dripping down the back of your throat, causing some scratchiness, frequent throat clearing, or similar symptoms. It's often worse at night. The treatment is relatively simple. Nasal steroids. So these are medications like fluticasone, betamethasone, that are simply squirted into the nose, one spray in each nostril twice a day to start for about a week, and then you can cut back to one spray in each nostril once a day. Most people will notice improvement within a few days, but sometimes it can linger up to 2 weeks. If you hadn't had improvement in 2 weeks, it's likely not the cause. One caveat with using these medications is that, especially in the winter when the conditions tend to be a little more dry, they can cause some bleeding from the nose or nosebleeds. So I would recommend using a saline spray, normal saline spray, nasal spray that you can get from over the counter, probably in the same section that you find the nasal steroids, and using this after you use the steroid spray. This will help combat that, and also using a humidifier can be helpful. If you have upper airway cough syndrome and you think you're having these symptoms of postnasal drip, but you also have nasal congestion, then you can also try an oral decongestant. These are things like pseudoephedrine, also known as Sudafed. So this medication can be very helpful on a short-term basis, but you have to know that it may raise blood pressure. So people that have an issue with their blood pressure, or they have a concern about maintaining their heart rate in a narrow range by their doctor, they should talk to them first. But in general, the medication is safe to take for up to a week, but if you don't have improvement, then I would stop taking the medication. Sprays like Afrin, which are nasal sprays of a similar medication to Sudafed, should only be taken for 2 to 3 days max, because if you take it longer than that, you're going to have this rebound effect called rhinitis medicamentosa. This is essentially just describing a phenomenon where if you take too much of this medication, you start to have a dependency on it, and then getting off of that can be very difficult. So only 2 to 3 days max Afrin if you're going to take it. So we've talked about asthma, we've talked about upper airway cough syndrome, and now we have to talk about laryngeotracheal reflux, or GERD. So a lot of people know this commonly as heartburn. So heartburn, as it sounds, is the sensation of some chest discomfort after eating. Usually occurs with spicy foods, with larger meals, with alcohol, with caffeine, peppermint. So a chocolate peppermint patty shot pretty much gets everything that you need to know to avoid outside of the spiciness. So if you're having symptoms of this, things that you can try are avoiding large meals, minimizing extra spicy food, sitting upright for at least 30 minutes after you eat, not eating and then going to bed right away, and then you can try some over-the-counter antacids as well. We'll talk about more of these in detail in a separate video, but I think that can at least give you a starting point for how to approach heartburn or reflux. Great, so I hope this information was helpful. We went through a lot of information today, from asthma, heartburn, reflux, upper airway cough syndrome. upper respiratory infections, new medications that may cause your cough, and some treatment options that are available. Dextromethorphan, guaifenesin. I should mention that there are, of course, lots of other treatment options that are available for cough, but these are prescription medications, so you'd have to see your doctor to get some of those. And if you have any questions, please let me know. You can reach me at Ryan, R-Y-A-N, at AskYourMD.org, or you can comment below. Hope to see you soon, and maybe I'll see you running in Central Park.